Right now and in this exact moment, if you are sitting on a soft, comfortable, cushiony sofa watching this video, I need you to pay very close attention to what I am about to tell you, because that sofa, the one that feels so good, so relaxing, so perfectly comfortable at the end of a long day, is quietly doing something to your spine that no painkiller, no chiropractor, and no physical therapist can fully undo as long as you keep sitting on it. And the cruelest part of all, the softer and more comfortable it feels, the more damage it is actually doing. I know that sounds completely backwards. I know that sounds almost impossible. But by the time this video is over, you are going to look at your sofa in a completely different way, and you are never going to sit on it the same way again. So before we go any further, if you have a friend, a family member, a coworker, anyone in your life who has been struggling with chronic back pain and cannot figure out why nothing seems to help, pause this video right now and send it to them, because what we are about to cover could be the single most important thing they watch all year. And if you are new to this channel, hit that subscribe button right now. We bring you honest, research-backed, and genuinely life-changing health information every single week. This community is growing fast, and I do not want you to miss a single video. Now let us get into this, because what I'm about to share is going to completely change the way you think about comfort, rest, and your back pain forever. Let us start with a question that most people have never actually thought about. What does comfort actually mean when it comes to your spine? Because here's the thing, comfort and support are not the same thing. In fact, when it comes to your back, they are often complete opposites. Something can feel incredibly comfortable in the moment while simultaneously causing serious structural damage to your spine that you will not feel until hours or even days later. And nothing illustrates this dangerous gap between comfort and support better than a soft sofa. To understand why, we need to talk about the anatomy of your lower back and what happens to it the moment you sink into a soft, unsupportive surface. Your lumbar spine, the lower portion of your back, has a natural inward curve called a lordotic curve. This curve is not just aesthetic, it is a critical structural feature that distributes the weight of your upper body evenly across your spinal discs, keeps your vertebrae properly aligned, and maintains the correct tension in the muscles, ligaments, and tendons that support your spine. When your lumbar spine is in its natural lordotic curve, your spinal discs, the gel-filled cushions between each vertebra, are underbalanced, even pressure. This is your spine in its happy place. This is the position where your spine can function, recover, and heal. Now, here is what happens the moment you sit down on a soft sofa. The cushions beneath you compress unevenly under your body weight. Your pelvis sinks down and tilts backward, a movement called posterior pelvic tilt. The moment your pelvis tilts backward, your entire lumbar spine loses its natural lordotic curve and flattens out or even reverses into what is called a kyphotic position, a rounded C-shaped curve. This is the opposite of where your spine wants to be. In this position, the front portions of your spinal discs are compressed while the back portions are stretched and put under tension. The nucleus pulposus, the gel-like center of your spinal disc, is pushed backward toward your spinal nerves. Your spinal ligaments are placed under constant, prolonged stretch that weakens them over time. The deep stabilizing muscles of your lower back, the multifidus and the transverse abdominis, essentially switch off because the sofa is doing the work of supporting your body, and these muscles do not need to engage. And your hip flexors, the muscles at the front of your hips, shorten and tighten in this seated position, pulling your pelvis further out of alignment and creating even more strain on your lower back when you eventually stand up. Now, here is what makes this so particularly damaging. Most people do not sit on their soft sofa for 5 or 10 minutes. They sit there for 2 hours. 3 hours, sometimes 4 or 5 hours in a single evening. Every minute that your spine spends in that compromised, flattened, posteriorly tilted position, the damage compounds. Your spinal discs, which have very limited blood supply and rely on movement and proper alignment to receive nutrients and expel waste products, become progressively more compressed, more dehydrated, and more vulnerable to injury. Your weakened stabilizing muscles become less and less capable of protecting your spine when you finally stand up and move. And the inflammatory processes in your already irritated joints and soft tissues are significantly amplified by the prolonged mechanical stress of sitting in this position. This is why so many people with chronic back pain notice that their pain is actually worse in the evening and first thing the next morning. Not better. They rested all evening on their comfortable sofa. They should feel better, but instead, they feel worse, stiffer, more painful, more restricted. And now you know exactly why. The thing they thought was helping them recover was actually the primary source of their continued decline. Now I want to share a story with you that captures everything we have been talking about in the most human and personal way possible. Ethan is a 58-year-old high school basketball coach from Nashville, Tennessee. He had been dealing with chronic lower back pain for about 3 years, ever since a minor injury during a practice session that never quite healed properly. Ethan tried everything that his doctor recommended. Physical therapy twice a week for 4 months, anti-inflammatory medications, a course of epidural steroid injections. He even bought a brand new orthopedic mattress that cost him nearly $3,000 based on his doctor's recommendation. And while some of these things provided temporary relief, the pain always came back. Always, without fail. Every single week started the same way, with Ethan waking up Monday morning feeling like his lower back had been through a car accident over the weekend. Ethan could not figure out what was happening on weekends that made his pain so consistently worse. During the week, he was on his feet most of the day coaching, walking the hallways of his school, staying active. But on weekends, he rested, which is what everyone told him he should be doing. He spent his Saturday and Sunday evenings on his large, deeply cushioned sectional sofa watching sports, relaxing, doing what he thought was allowing his back to recover. He had bought that sofa 3 years ago, right around the same time his back pain had started, but he never connected the two. It was actually his physical therapist who finally made the connection. During one of their sessions, she asked Ethan to describe a typical weekend in detail, hour by hour. When he got to the part about spending 4 to 5 hours on his sectional sofa each evening, she stopped him. She asked him to describe the sofa. Deep cushions? He said yes. Very soft and comfortable? He said absolutely. Do you sink into it when you sit down? He said it was like sitting on a cloud. His physical therapist looked at him and said, "Ethan, I think we just found your weekend problem." She explained the biomechanics of what his soft sofa was doing to his lumbar spine every weekend evening. The posterior pelvic tilt, the loss of lordotic curve, the disc compression, the muscle shutdown, in exactly the way we have been discussing in this video. And then she gave him a simple protocol to follow. She did not tell him to throw away his sofa. She gave him practical, immediately actionable strategies to completely change how he interacted with it. Ethan followed her advice starting that very next weekend. 4 weeks later, he came back to his physical therapy session and told her something remarkable. For the first time in 3 years, he had not woken up on a Monday morning in severe pain. His weekends were no longer making his back worse. In fact, for the first time, he felt like his weekends were actually allowing his back to recover. He was genuinely emotional about it. 3 years of weekend suffering, 3 years of Monday morning agony, ended in 4 weeks simply by changing how he sat and supported his back during his evening rest time. Ethan now tells every single one of his athletes who complains of back pain, the first question I ask them is, what kind of sofa are you sitting on and how long are you sitting on it? Because his physical therapist taught him that the answers to those 2 questions often reveal more about someone's back pain than any MRI ever could. So what did Ethan's physical therapist actually tell him to do? What are the practical, immediately actionable steps you can start implementing tonight to stop your sofa from destroying your back? Let us go through each one carefully. The first and most important change is lumbar support. This is non-negotiable. Every single time you sit on your sofa, you must place a firm lumbar support pillow in the small of your back, right at the curve of your lower spine, before you sit back. This pillow serves as a physical barrier that prevents your lumbar spine from flattening out when you sink into the soft cushions. It maintains the natural lordotic curve of your lower back even as the rest of your body relaxes into the sofa. You do not need an expensive specialized pillow for this. A tightly rolled bath towel works perfectly well and costs nothing. The key is that it must be firm enough to actually hold the curve of your lower back. A soft, fluffy pillow will compress under your weight and provide no meaningful support whatsoever. The second change is your sitting position. Instead of sitting all the way back into the deep cushions of your sofa with your back fully reclined against the backrest, which is the position that causes the most spinal damage, try sitting slightly forward on the sofa cushion with your feet flat on the floor and your hips at or slightly above the level of your knees. This position naturally encourages a more upright pelvis and helps maintain the lumbar curve even without a support pillow. It requires more engagement from your core and back muscles, which is actually beneficial It keeps those stabilizing muscles gently active rather than completely switched off. The third change is the 30-minute rule. No matter how comfortable you are, no matter what you are watching, commit to getting up from your sofa every 30 minutes and moving for at least 3 to 5 minutes. Walk to the kitchen. Do a gentle standing back extension. Place your hands on your lower back and gently arch backward 5 times. Walk up and down your hallway. These brief movement breaks allow your spinal discs to rehydrate, reset the pressure distribution in your lumbar spine, reactivate your stabilizing muscles, and prevent the progressive mechanical damage that comes from sustained static sitting in a compromised position. Setting a timer on your phone is the simplest and most effective way to make this habit automatic. The fourth change is sofa selection. If you are in a position to choose or replace your sofa, look for one with firmer cushions and a higher seat height that allows your feet to rest flat on the floor with your knees at approximately 90 degrees. A sofa that is too low or too soft, one that you visibly sink into when you sit down, is not suitable for anyone with chronic back pain, regardless of how comfortable it feels. The ideal sofa for back health has cushions that are supportive rather than plush, a seat depth that allows you to sit back without your feet dangling, and a backrest that is angled only slightly, not reclined dramatically, so that it actually encourages spinal alignment rather than collapsing it. The fifth change is how you get up from the sofa. This is something almost nobody talks about, but it is critically important. Getting up from a deep, soft sofa incorrectly is one of the most common moments when people with back pain experience acute flare-ups and injury. Never push yourself straight up from a deep reclined position. Instead, first slide forward to the edge of the sofa cushion, then lean slightly forward from your hips, not your waist, keeping your back as straight as possible. Then push up using your leg muscles, not your back muscles, and use the armrest for support if needed. This technique distributes the mechanical load of rising away from your already stressed lumbar spine and dramatically reduces the risk of acute injury during what seems like a simple, everyday movement. The sixth and final change is what you do after sitting. Every time you finish a long sofa session, particularly one that lasted more than 30 minutes, spend 5 minutes doing gentle lumbar extension exercises before you sit down again or go to bed. The cat-cow stretch performed on your hands and knees, the standing back extension, and the child's pose are 3 of the most effective and gentle ways to decompress your lumbar spine, restore the natural lordotic curve, rehydrate your spinal discs, and reactivate the stabilizing muscles that your sofa session switched off. Making these 5 minutes non-negotiable every evening, just like brushing your teeth, can make a significant difference in how your back feels the next morning. Let us bring everything together. Your soft sofa feels comfortable because it conforms to your body. But that is exactly the problem. Your spine does not need something that conforms to it in its compromised, relaxed position. It needs something that supports it in its correct, healthy position. Comfort and support are different things. And for anyone with chronic back pain, choosing support over comfort every single evening is one of the most powerful decisions you can make for your long-term spinal health and your quality of life. Ethan learned this, and it changed 3 years of chronic pain in just 4 weeks. The same is possible for you. Start tonight. Get that lumbar pillow. Set your 30-minute timer, change how you sit and how you rise, and pay attention to how your back feels tomorrow morning. Because sometimes the biggest breakthroughs in chronic pain do not come from the most complicated interventions. They come from fixing the simple, everyday things that nobody ever thought to question. Now, before you go, drop a comment below and tell me your age and the city you are watching from. And tell me, did you ever suspect your sofa could be making your back pain worse? I want to hear your story. I read every single comment personally, and this community is what makes this channel worth everything. And if this video gave you something valuable, if it gave you one thing you did not know before, please share it right now with someone who has been struggling with back pain that never seems to get better. Hit that subscribe button, turn on the notification bell, and I will see you in the next video. Take care of your spine, because everything starts and ends with a healthy back. This video is intended for educational and informational purposes only and does not constitute medical advice, diagnosis, or treatment of any kind. The information shared is based on publicly available research, biomechanical studies, and general wellness information. The patient story featuring Ethan has been included for illustrative purposes only and reflects experiences consistent with existing research. Individual results will always vary. Always consult with a qualified and licensed healthcare professional, including your physician, orthopedic specialist, or physical therapist, before making any changes to your posture routine, seating arrangements, or back pain management protocol. The creator of this channel is not a licensed medical professional. No statements in this video have been evaluated or approved by the United States Food and Drug Administration. Nothing in this video is intended to diagnose, treat, cure, or prevent any disease or medical condition. Never disregard professional medical advice or delay seeking appropriate medical care because of content you have watched online. If you are experiencing severe, worsening, or debilitating back pain, please seek immediate evaluation from a qualified healthcare provider. Viewer discretion is advised.